Afternoon, everyone. My name is Connor Harrison. I'm with Intermountain Healthcare Communications. Today, I am joined with Brandon Webb, one of our infectious disease physicians. And we just kind of wanted to talk through the topic of when is the right time to go to one of our facilities or to access care. So we've kind of got some populated questions. If you have any questions around this topic, please drop them in the comments, and gentlemen will hand those questions to us so we can hopefully get those answered today. If not, if you're watching this broadcast later, you can still drop the questions in the comments and we will work through answering those. So let's kind of jump right in. Going back to that big question, when is the right time to go to one of our facilities?
Yeah, I appreciate the question because it's changed a little bit with the coronavirus. So we actually are strongly encouraging people who have mild symptoms to stay home.
Right.
So most mild symptoms that are not complicated by other medical conditions, and you know who you are if you have complicating medical conditions. But for those of you who are healthy generally and have mild symptoms that wouldn't otherwise prompt you to go to the doctor, you should stay home. You should treat symptomatically. And you can use resources to help monitor your symptoms.
Right. Can you maybe elaborate on some of those resources, or maybe things we should be doing when we are at home? Like, how do we, I know Dr. Stenyum kind of talked yesterday about self-isolation, but maybe we could go through those.
Absolutely, yeah. So our overall strategy with the coronavirus is to temper the impact, to work together as a community. And we do that by staying home. When you're at home, washing hands, staying away from other people. If we had 6-foot hula hoops, that would be the perfect thing, because staying 6 feet away from others is the best way to limit the spread. And then just taking care of your symptoms symptomatically, getting rest, staying hydrated, the basics.
Yeah, awesome. So let's kind of go to the next step here. If my symptoms are worsening or they're not as mild as you just described, what's the next step for us?
Yeah, so if you feel like your symptoms are deteriorating or getting worse, the first step is to access one of the online care resources that we have. That allows you to remain at home and still get the advice that you need from a healthcare provider.
Okay. And then, what's the next level here?
Yeah. Unfortunately, there are some circumstances where you do need to be seen in person by a healthcare provider. Shortness of breath, difficulty breathing, confusion, some of those symptoms that raise red flags. If you do develop symptoms like that, we do want you to access one of our healthcare facilities where we can evaluate you and make sure that you're receiving the appropriate care. Some of the best first places to access would be InstaCares or urgent cares.
Right. And there's even, we've set up a call line and we call it Intermountain Health Answers. This phone number is really a great resource for calling in and kind of getting triaged to determine if you should access a facility.
Yeah. So the Health Answers is a phone line that's staffed by medical professionals who've been specifically trained to help walk people through the signs and symptoms of coronavirus and of many other infections.
Right. And that number, just so everyone is who's listening, is 801-442-5224. And this is a line, at this point, that phone number is set up specifically to answer COVID-19 questions and kind of help direct care if needed. If your symptoms are getting worse, they'll help you get to that next step in care.
Right.
So I think that is a really important resource, and I'm sure your team's been heavily involved in that.
We have.
I know before this you mentioned you've been staffing the line and whatnot. So I think that's important to understand that it's trained healthcare professionals that are answering those questions.
Absolutely.
And leading to that. What happens at that point as those symptoms are getting even more worse? What's the next step here?
Yeah. So if you're concerned that you have red flag symptoms, symptoms that would require evaluation in person, some of those symptoms might be can't catch your breath, breathing rapidly and are short of breath, confusion, dizziness, weakness. Those are symptoms that should be evaluated, and you can use some of our online care options to help you determine whether you've reached that point or not. Right. The other thing that's a little bit different right now with the coronavirus is that we're taking into account some factors that do put you at higher risk of having coronavirus, such as travel in the last 14 days to areas where transmission is widespread, or close contact with someone who has been confirmed to have coronavirus. If you have questions about whether you meet those high risk, contacting Health Answers is a great way to walk through and assess your risk.
Right. So what are ways, you mentioned travel and close contact. We're sitting really close right now. Not necessarily the best thing. There's kind of been this term that's been brought up, which is called social distancing.
Right.
Can you kind of explain that? I know yesterday Dr. Stenyum talked about it, but I think that's important here as well.
Yeah. I think it's good for everyone to know that our overall strategy is to temper the impact of coronavirus transmission in our community. And we do that by working together to limit our proximity or our closeness to other people, because that's how the virus is transmitted.
Right.
And if we do that, we can do several things. One, we can protect those patient populations that are most vulnerable, and we can avoid overwhelming our healthcare facilities. And that way we can continue to provide care for patients who do need it. Some of those social distancing techniques are to avoid public places where there are crowds. Mm-hmm. Another one would be to imagine if you had a 6-foot hula hoop. You want to stay about 6 feet away from other people.
Right.
So you and I are way too close.
Hand sanitizer. We used it before this. Kind of in that approach of social distancing, is that perhaps one of the reasons why we're also asking that you stay home and you don't access one of our facilities? Because, we do treat patients for other reasons. Can you kind of explain social distancing and accessing our care and kind of how that fits within that?
Yeah, that's a great question. So the reason we're shifting is because we do want to emphasize that if you have symptoms that are mild and can be managed at home, that's the best place. Right. It's better to stay at home where you don't have contact with other people who may be ill. And it allows our healthcare facilities to serve those who do have symptoms that require acute care.
Great answer. So for those of you who are watching live right now, feel free to drop questions in the comments and we can get a few of those answered here. If you're watching this back, please feel free to continue to ask the questions that you have, and we will work our best to respond to those in a timely manner. We just received one question. Do diabetics need to practice anything different than others?
Yeah, that's a great question. So patients who have chronic medical conditions, including diabetes, heart disease, any liver disease, they should pay a special care to avoiding those public situations. Right. Because their immune systems may not be as capable or functional as other people. Diabetes specifically does affect the immune system, and so we'd recommend anyone with chronic medical conditions to pay special care to hand hygiene using hand sanitizer and to social distancing.
Right. So if I were to walk into an InstaCare ED, let's say I didn't call Health Answers, I'm really worried, what are the chances that I'm going to get treated for COVID-19?
So right now, if you walked into an urgent care or InstaCare, you'd find that it's very busy. Right. And it's busy because there's a lot of people who understandably are concerned about coronavirus. But unless you have high-risk features that have put you at higher risk of actually having acquired coronavirus, you won't be tested at one of those outpatient facilities.
And what would be the reason why are we not testing everyone who comes in?
Yeah, that's a great question. It's because our testing is actually limited right now, and so we're giving preference to testing patients who are at higher risk of having complications of coronavirus or who are already in the hospital, who we need to know if they have it to avoid spreading it to other patients and healthcare providers.
So I think this is another important point just to bring up. If before you come to the InstaCare or to ED, we ask that you please call Health Answers. That number again is 801-442-5224, and they'll really help triage the need for you, depending on your symptoms and whatnot. So just another question that we got in: should I still attend my regular scheduled appointments? And I think we addressed this briefly before, but
I think it's a good question to ask your provider. So in many cases right now, if you have a regularly scheduled appointment and you're healthy and doing well, your provider may actually refill your prescriptions and give you advice and advise you not to come in. But I would have that conversation with your provider in his or her office.
That's great. And I think that's really important to understand that, as this public health concern continues to grow, we still have other health needs that we're addressing. And so things are shifting, and that's kind of why we're here today, to really talk about those shifting things. Is there anything else that maybe we haven't covered here that you'd like to touch on or re-emphasize?
I think what we've talked about are the most important keys to working together as a community to limit the spread, to preserve the resources we do have, to protect those individuals in the community who are at higher risk. But also, we do want people to recognize that if you have had exposures or travel that does put you at higher risk, we have professionals who I've been working with very closely over the last couple of weeks to make sure that they're trained to recognize those features so that we get people to the right area of care.
Great. So I think the next question that we got, and we've gotten this question a lot, kind of about moms and infants, and how, is there anything specific that we need to know regarding care for infants?
So coronavirus is a little bit unusual. It does tend to affect the elderly more than the young. But because infants and young children are a vulnerable population when it comes to respiratory infections, I would recommend that you treat your child the same way you would if we were not in an outbreak situation. Meaning, if they have mild symptoms, it's appropriate to manage those symptomatically at home. If your child is exhibiting symptoms that raise concern, then that's a reason to contact a provider first and ask for advice on the best next steps. And that way we can triage infants and children to care locations that are going to be the most appropriate for them.
Great answer. I hear a question coming, and I think we'll wait to grab it. So should pregnant women take any special precautions?
Another population that we want to pay special attention to. So pregnant women definitely should take especial care to social distance, to stay hydrated, to get plenty of rest, to avoid areas where there are crowds. And if they do develop symptoms, we want them to follow the same steps to contact one of our online or telephone resources and allow us to advise you on the best place to receive care.
Great. Well, thank you so much for your time today. Just a few resources that I'd like to call out. You can visit intermountainhealthcare.org/COVID-19 for a whole bunch of resources and information that we're continually updating. You can also contact Health Answers, as we've discussed several times, and that phone number is 801-442-5224. So thank you so much for joining us, and look to continue to follow us here on Facebook for more information as it comes out. Thank you, and have a great day.
Thanks, Connor.